So let's say you've decided to do the procedure, you have the facelift done. What are your expectations? First of all, of course, at first you have to go through the recovery period. That can be anywhere from 3 weeks to 6 weeks. Most of the time at 3 weeks, you're looking good, but you still have a ways to go. The incisions can still be seen a little bit. You're still puffy in one area more than the other. And then it slowly gets better and better. And then by 6 weeks, even 2 months, wow, I'm so glad I did this. Then over time, you remember you're still starting to age from the time you had your procedure. What about if you lose a little weight or gain a little weight? That all will change the duration of your procedure. As we age, people lose collagen again. So you may need, say at a year, a little bit of what we call a tuck up. If you had a lot of skin, you don't want to overdo the facelift up front to sacrifice your look, or you're afraid it may not last. You'd rather say, I want to look as good as I can, be natural, and then let's see how you do at a year. You may need a tuck up. I'd say in my hands, about 10% of people have a little tuck up, which is a much shorter procedure, not as much downtime, and that gets rid of maybe that little bit of skin that comes back around the jowls or under your chin. Second, what about after that, or when you don't need a tuck up? How long will a facelift last? In our hands, we're doing a muscle procedure where we're actually establishing the muscle where it was 10 years ago. So I always say, these are usually good till about 10 years, where you'll start seeing that it may need a little bit of revision, or it just depends on your age when you first had it. Second, if you have an illness or again change in weight or something of that nature, that may change things. But overall, facelift can be done safely, look natural, and will last a long time. Call us for a consult and we'll give you our best opinion.